Hi everyone, this is the Healthy Melissa Mullen, functional medicine nutritionist and NAEP practitioner, and today I want to talk about the importance of optimizing your liver function for your hormones to be balanced and metabolizing properly. So when you have a person that has estrogen receptor positive breast cancer, the doctors will want to put this person on medications that will take out a lot of their estrogens, suppress a lot of their hormones, and that can be okay if somebody has estrogen dominance. However, there's also the fact of how your estrogens are metabolizing through your liver, and that's not really paid attention to as much as it should be, I feel. When I do the Dutch test, it's a urine and saliva hormone test. It shows exactly the total estrogens and how they break down into estrone, estradiol, and estriol, E1, 2, and 3. And these pathways are either protective or they're harmful, or they just make the estrogens you have more potent. And in order for your liver to be processing your hormones efficiently, it needs a lot of cofactors. It needs B vitamins like B6, B12, folate. It needs glutathione, amino acids that you get from proteins. It needs polyphenols. It needs micronutrients like zinc and magnesium, vitamin A, many things. And when you have a disadvantage there, you're missing certain nutrients, your liver is going to be less efficient at detoxifying and removing or just metabolizing your estrogens. Now, pair that with drinking alcohol, drinking coffee, a lot of caffeine, smoking, cigarettes, toxins, all these things that you are being exposed to, medications as well. That all gets filtered through the liver, and it needs B vitamins, it needs all those cofactors to be reduced and eliminated through the liver. And then when you pair on top of that almost everybody has some sort of a liver enzyme mutation. And some liver enzyme could be CYP1B1, CYP1A1, it could be other ones. So the liver is the target area where you really want to focus on optimizing. If you're somebody who's drinking alcohol or having a glass of wine every night, or you're drinking caffeine multiple times a day, the liver enzyme CYP1B1 is also responsible for breaking down estradiol, and it breaks down caffeine. So if you're drinking caffeine all the time and you have a genetic mutation in this enzyme, your liver is going to prefer to break down the caffeine over the estradiol, and it's just less efficient. So then you get higher amounts of estradiol. It's not metabolizing, not being detoxified, because maybe you're low in glutathione, maybe you're low in B vitamins. So it's like all a big loop that needs to be looked at. It's not just take tamoxifen and take all your hormones out. Yeah, but the hormones you do have, could they be metabolizing unfavorably? The other pathway, the 16-OH, which is estriol, that is a very potent estrogen that makes whatever estrogens you do have more potent. It exacerbates any kind of estrogenic symptoms you might have. So if you are somebody who has really bad cramps, breast tenderness, nipple tenderness before your period, PMS, that's going to be likely your estrogens are metabolizing more down that 16-OH pathway. And the Dutch test is the best test to check for that. Luckily, all of these things are very much correctable with your liver and increasing or decreasing the rate of the liver enzymes if one is overexpressing or if one is less efficient. So many modifications that you can make to balance any observed issues in the Dutch test.